If you're a physician who's excellent in the clinic, patients love you, colleagues respect you, you know you're that girl in the clinic, it comes to exams and you freeze, this video is for you. This experience is more common than people realize, but it's not talked about openly. It's not talked about often. And for that reason, many physicians assume that something is wrong with them, when in reality, something very specific is happening in the brain, the nervous system, and the body. Hi, I'm Dr. Bianca Bush, board certified psychiatrist, coach, educator, and I help medical students, residents, and fellows who are clinically capable but feel stalled by high stakes exams. Today, I'm going to walk you through 3 reasons that clinically competent physicians freeze during boards and what that experience actually means. One of the most disorienting parts about this experience is the contrast. You may be functioning well clinically, you make complex decisions from day to day, you effectively multitask, you manage uncertainty, you carry responsibility. Literally, you have people's lives in your hands. And then you get to this exam, you get to the boards, and something very different happens. And when that mismatch isn't explained, physicians will internalize it as a personal failure. I have seen this time and time again. Instead of recognizing what's happening, that this is a state dependent response. So this isn't about intelligence. It's not about professionalism. It's not about skill. So let's get into reason number 1. Why does this happen? Boards trigger a threat response, right? This is not, your body is not perceiving this purely as a knowledge check. The first reason competent physicians freeze during board exams is because your brain is perceiving the exam as a threat, not a neutral assessment of knowledge. And so clinical work happens in context, right? There's movement, like literal physical movement, walking around the clinic, which can help combat the anxiety or threat response. There's relational grounding with your patients. There's pattern recognition, right? After a while, that's what residency fellowship is about, seeing things over and over so that we can recognize them. You have time to research and think. You have time to collaborate with others. And your professional identity is intact, right? You're known as Dr. So-and-so in the clinic, in the OR, Dr. So-and-so, right? But boards remove all of that. You're at some prometric testing center and God knows where, maybe your town where you live, maybe you've had to travel. And so boards are combining high stakes time pressure, the permanence, like the outcome of this exam is going to be really impactful, and then evaluation all at once. And so instead of this being an opportunity that's collaborative, you can be resourceful, you are alone, right? You're out of your normal environment. So when the brain perceives threat, it prioritizes survival over access. So that means narrowed attention, impaired working memory, and even though the information is there, you have difficulty retrieving it. So, when talking to physicians like you who struggle with this very issue, I find that it's not a matter of content mastery. That's not the problem. It's not a deficit in preparation. Goodness knows that we have gotten this far because we're diligent students and we prepare, but really, it's a predictable nervous system response. So, I want to pause here and I want to invite you to reflect on your own experience, right? You do not have to comment below, but not the outcome of the exam, whether you passed or failed. But I want you to think about what's happening internally, right? Let's go back to the last time you took one of these exams. You're driving to the testing center. What was that like? What did it feel like? Did you feel, an uncertainty or kind of like a jitteriness that was preparing your mind to go and execute? Or were you having a physiological response, right? Did it feel like physiological threat where you had a tightening of your chest, racing thoughts, sweaty palms? Did you find yourself scrambling to access information that you knew was there? Did you experience a time distortion, thinking that, like, oh my gosh, time is moving so quickly, right? This distinction really matters with how you test. So, again, I want to highlight, I'm not talking about content. I'm not talking about, did you sort of see in your mind, all right, they're going to ask me about boop, 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 boop. No, I want to know what was happening in your body as you were going to that exam or as you were sitting in the exam. All right, let's get back to reason number two that this happens to clinically competent physicians. Competence in the clinic can be disorienting in the test room. So, the second reason this impacts competent physicians is that years of training actually lead to an increased internal pressure, right? Because you are thinking that you're prepared, you know that you're prepared, but then you're getting to this testing environment and it's weird, right? So, let's talk about more about what this means. We have learned to push through discomfort, right? To function under stress, to keep going even when we're tired. And I don't know about you, but if you're partnered to someone who's not in medicine or a related field, it kind of blows their mind with how we are able to function on little sleep. Not that it's good, but this is what we do, right? So, core memory moment, right? You're in the dark call room, your pager goes off, you wake up from sleep, and immediately you're ready to give an opinion or evaluate someone or treat a patient, right? You do it almost without thinking quickly because we rehearsed it. Boards removes that external scaffolding that usually helps us regulate our system. So think about it. Even when we're under that intense pressure on call, in the OR, in the clinic, we can rely on teamwork. We can rely on movement, like literal physical movement. And I just want to say that teamwork, right? We might be the only resident or physician on call, but we have all the support staff. If you're going down to the ED, you're going to see the nurses that you normally see. You're going to see, gosh, the social worker. You might even see security officers that you're familiar with, right? That is the teamwork. You're going to have access to educational resources, right? You forgot something, you're going to look it up really quick on Up to Date or even Open Evidence, or maybe you're going to refer to your notes, right? But all of that is gone. It's absent in the testing environment. And so the nervous system registers this as a loss of control combined with a loss of support, combined with the high consequences of taking this exam that's probably only offered once a year, maybe twice a year, maybe once every other year, right? That is an intense pressure setting. So, paradoxically, the more capable you are in clinic, the more disorienting this experience in the exam room can be. So, your brain is not questioning your competence, right? It's really responding to a perceived threat and an unfamiliar environment. Reason number three, more studying doesn't address access. And this is a place where physicians really get stuck because the natural response is to just study more. We're here because we've been good students all along the years, going back to elementary, middle school, right? And so we have been trained that as a good student, oh, if you just study, if you just put in more time, it's going to get easier. You're going to have no problem. Well, that's not the case, right? I've done it myself, right? I failed an exam. If you've been following me, I failed many exams. And I thought to myself, all right, let me just get more materials. I'm gonna buy another Q bank. I'm gonna go to the primary text, right? I'm just gonna read the textbook. But what I know is that that doesn't help. Additional content review doesn't resolve the nervous system access problem. In fact, repeated high pressure attempts, so that's if you're taking the exam over and over again, can sensitize the system further so that you're just a complete ball of nerves even before you sit for that exam. So let's say, for example, you have taken step one twice and failed. That really can keep the nervous system in that threat response, in that sympathetic activation, so that when you're sitting down to study for the third exam, you're just a big ball of nerves. And that is not a good setup for information retention. So, again, it's not about content. The information is often there, but the challenge is reliably accessing that content under threat. So, this is why many physicians describe knowing the material, but when they get to the exam, they feel like their mind just goes blank. So, some physicians, some people that I've worked with, have found it helpful to access or to assess rather whether or not this is actually happening. And so, I put together a quick quiz so that you can identify where you are in sort of test related anxiety or performance anxiety. So, the link is below. Check it out. It's quick. I think it's about 5 minutes, and you're going to get a sense of, is this happening for you? All right. So, if this resonates, I want to be very clear about something. This experience that you're having on exams, during exam time, whether it's oral, written, this does not negate your knowledge. This does not say that you are less competent. It doesn't erase your years of training. It doesn't mean that you're incapable. What you're experiencing, again, is a state dependent nervous system response. And it's important to know that this pattern is modifiable. I think that's the most beautiful thing about all of this, right? There's something that we can do because when your nervous system feels safer, you can access what you know, right? That access returns to you. So here are a few things that you can do right now. Number one, orient your body. As I've stated, this is not just about studying more. So success on your next exam attempt is going to result from changing the state that you're in as you approach that exam. So just before you do your next exam related activity, whether that's reviewing questions, going through your Anki deck, maybe even reviewing some of the content, I want you to sit back, place your feet on the floor, and take a slow exhale that's longer than your inhale. That really triggers the parasympathetic response that's going to counter that threat response, right? It signals to the nervous system that there's no immediate threat, and that is a prerequisite for cognitive access. Number two, I want you to rehearse safety. Because your body is in this fight or flight, we have to rehearse that it can relax. I want you to stop rehearsing the exam in its most threatening form. Many physicians will mentally rehearse boards as a moment of failure without even realizing it. If you're a person who has a tendency to worry, you might get caught up in your mind thinking about what happens if you get a question on something you don't know, or what happens if your computer freezes, or the lights go out, or maybe you're sitting next to somebody who's sniffling loudly, right? All of those are the worst case scenarios. So instead, I want you to picture yourself sitting down, opening up that exam, noticing the first question, staying oriented in your calm body, not panicking as you approach your questions, but approaching them calmly, confidently. I want you to picture the test environment with like the most optimal temperature. You're not cold, you're not hot. There are no distractions, right? So I want you to picture that, rehearse that in your mind. And by doing this, you are rehearsing safety, a sense of safety. And that's going to take your body out of the threat response. The third thing I want you to do is to get some support. Many of you are suffering silently and alone. And I know this because I've talked to hundreds of physicians and they're like, oh my gosh, thank you so much for saying this out loud, because no one is, right? You've maybe only told your mom, you've only told your partner about this experience, your boss doesn't know, your colleagues don't know. And I do this work because I know that excellent physicians are getting stuck. And to me, that is so sad because that means the world is not able to see you, to access you in all of your greatness. So I want you to seek support. And that can be through self-guided resources, right? We're talking about calming the nervous system. So maybe there are some books, maybe some workbooks. Maybe you're going to take the next step and access confidential therapy or coaching. That's a great option. Maybe you're going to do a structured program that's designed specifically for physicians. Okay, plugging myself here. I put together a program called Test Anxiety No More. It's a self-guided option, about 4 hours of video, quick, because I know you don't have a lot of time, but it can really help you with mindset, body relaxation, right? But the point is, I want you to get some support. You don't need to announce it. You don't need to justify it, and you don't have to do this alone. But you're here today because you know something has to be done. Something needs to change. Okay, if you take nothing else from this video, remember this. Freezing during boards is not a competence problem. Many capable physicians experience this quietly, and support exists, right? I don't want you to keep doing this alone. I don't want you to repeat the pattern. So you can explore more here on your own terms. Check out other videos on my channel. But the point is, I want you to know that you're not alone, that you are capable, you can do this, and people are depending on you. All right. Thanks for joining me today. I'll see you next time.